So, Marvin, it is your turn in the hot seat. um, so, you're the honorary librarian at the Royal College. You are also a consultant geriatrician at Glasgow Royal Infirmary. So, I was wondering if I could ask you, COVID, the COVID vaccine, as we've mentioned, was one of the most rapid rollouts of any vaccination in history. Was that something that the medical profession anticipated?
Well, I can really speak on behalf of the entire medical profession, but I was going to try. I think it's certainly something I hoped would happen. I think initially during the pandemic, it was quite hard to envisage that happening. I think we were all in the middle of it, and it was hard to see the wood for the trees. I think, though, it is testament to not just the medical profession, but healthcare professionals, researchers as a whole, that it was managed to be trialled and dispatched and turned around as quickly as it was. And it is a testament to the healthcare professionals, in not just nationally, but internationally. So I think it was something that we obviously hoped, but I think when you're in the thick of it, it's hard to imagine.
Yeah, absolutely. And I mean, within a year, it isolated the pathogen. They, created this vaccine, which is incredible. And I do remember that every single piece of work that was ever published on COVID-19 was open access. Mm-hmm. So it was this amazing sharing, I suppose, of information, which is incredible.
I think the rapidity of information and what was available very early on, I'm not going to lie, was sometimes quite overwhelming. And it was ever changing because it was a new pathogen and we didn't really know what we were dealing with. And that sometimes that's worse than what actually happens, I think, in the sort of anticipation. But I think everything was so available. We had experts rapidly on it, rapidly assimilating information, and researchers starting and looking at what was going to happen and how we were going to vaccinate.
No, definitely. And we were just talking earlier about how smallpox really kind of transformed the college's role in public health, and it sort of changed its kind of focus from the medical profession to the public more broadly. Did that happen with COVID as well? How did the college respond to COVID from your experience?
So probably I'm a bit biased about the college's response. However, the rapidity of changing what we did, going online very quickly, having rapid access to information, because a part of that is round about disseminating information, turning around our education. We are a college, was done very quickly. It's a testament to the staff here, that they were able to turn everything around from being a in-person, mainly college, to remote learning, remote symposium, and remote exams latterly as well. I think I personally took some solace signing in to listen to the updates, because a lot of our members and fellows were part of the COVID response, and part of it was round about not just the clinical aspects, but non-clinical aspects too. And I think it showed the resilience of our staff and fellows and members, but also it showed that we weren't resistant to change and we could change things very rapidly.
Absolutely. And continue that change as well.
Absolutely. And that's continued on. And we're going back to hybrid events and in-person events. And I think not just messaging to our fellows and members, but to the public as a whole. We've always had close links with public health. In fact, one of the sort of Glasgow founding fathers of public health, J.B. Russell, I'm just going to put the plug in now, he was a member of the library committee of the college. So from very early on, we've had very close links with public health because it's evolved itself.
And of course, the pandemic was one of the worst things that could have hit the NHS workforce and the wider medical profession globally. What were some of the ways in which the college supported kind of, I suppose, member well-being and mental health during this time?
So we had various events for wellbeing and resilience. I'm not sure I quite like that word, but wellbeing and resilience. Our president, and that's continued in our current president, but our president at the time, actually pre-COVID, one of her focuses was on wellbeing and inclusivity. So it was very forward thinking of Jackie Taylor, our president at the time, to do that. So as a testament to our college office bearers that we did this. We had sections round about wellbeing. We had meetings on wellbeing. The focus of our president's conference was on wellbeing as well last year. And I think that is really important. But I think actually just talking and being able to do that when you can't be face to face was really important.
Brilliant. So we spoke about, the emergence of COVID, the impact of COVID, and then the delivery of, or the emergence, I suppose, of the COVID-19 vaccine. What was the impact of the vaccine in terms of turning the tide on the pandemic? And maybe just more broadly, what is the impact of vaccines on public health, on global health?
Mm-hmm. So with COVID specifically, I don't think we'd be able to do something like this at the moment without having the vaccine. And it's actually quite hard to describe the difference that it's made to. I'm a geriatrician, so the difference it's made to my population. Obviously, people still are getting COVID, and we've gone through a wave quite recently as well. So it's still around, but people are less sick with it, and I think we're able to look at what we can do as a society now. COVID is not going away, and I think, I'm not trying to be too negative, but it's not. So having the vaccine is definitely, having boosters for the vaccine is definitely the way forwards to help as a population as a whole, because you have to get the population as a whole bought into the COVID vaccine as well. So that's been quite a testament for public health messaging from the government as well around about the rollout. Vaccines in general have revolutionised society as a whole. I think the figure is something like 3.5 to 5 million lives have been saved from vaccination. That's me quoting the WHO, not anything else. We've got vaccines available that help reduce infant mortality, and we've reduced deaths from diphtheria, tetanus, because we get vaccines from a very early age. There's also development of new vaccines, and I think when we decided to do this exhibition, we weren't thinking about too many emerging vaccines, and as I said earlier on, round about smallpox.
Yes.
But there's obviously developments round about monkeypox at the moment as well, and so MPX and vaccine development with that, and they are actually using smallpox vaccines for that just now for high risk groups of people. Mm-hmm. And that will be developed too. So it's an ever-changing world we have.
Like that, just as you say, that greater R&D, I suppose, that research, that development into these different diseases. And if there was, one thing you would want the public to take from the pandemic and the value of public health and the value of vaccination, what would that be?
So I'm not sure. There's just one thing, I guess.
I'll give you a few then.
I think the first thing is when people work together, look at the results. So this was an international effort. Multi-agencies worked across multiple countries. So I think when we all work together, much like you were talking about, it's the whole rather than just one individual aspect of things. When we all work together. We have to look to the future, and we have to be very aware that there will be emergent diseases, but we are more prepared because of what's happened. We are not going to stop travelling internationally. We're going to stop doing things. So we have to be aware of that. But the sort of steps that we've done this time round will help in the future. Definitely.
Fabulous. And what do you think, going back to the exhibition, what do you think the value is in looking at the past as opposed to maybe inform the present, but to kind of think about medicine in the present at the very least?
So I guess I mentioned J.B. Russell before because he was like Glasgow's first public health doctor. There's two quotes that I like from him. So he says, looking back over the history of successive epidemics, which have passed over the community wave-like, with intervals of remission, we find each wave has been met with expedients extemporised in the midst of its outset, And so he's trying to warn us that, don't just leave things to the last minute, that we have to be prepared. And then the other part of it is, the other quote is, the time for deliberation about a fever hospital, and I know we don't have fever hospitals anymore, but is during the interval when there is no fever in the city. So it's round about being prepared. And with COVID as well, there were obviously with periods, times where it wasn't as high in prevalence, and then there's times where it came up again. So I think he's trying to tell us from the past to be prepared, for other waves. As you were talking about earlier on, innovation over the last 200 years in medicine has been absolutely astounding. We've got that to look for in the future as well. And the building blocks, looking at, from Jenner onwards, is a good ground to start with and to take from.
Wonderful. Thank you so much for taking the time to speak with us, Marvin, and for sharing your overwhelming wealth of experience and knowledge. I really appreciate it.
No, thank you. Thanks very much.